Back with you tonight, and your reporting continues. The Omicron variant has now been detected in at least 19 countries, raising concern about the spread of the coronavirus. The World Health Organization has warned that the global risk from the spread of Omicron was very high. The organization has urged its 194 member states to speed up the delivery of vaccinations to high-risk groups. Joining me now to talk about this and more is the Technical Officer at the WHO Regional Office for Africa, Dr. Mary Stephen. Dr. Mary, good evening, and thank you very much for your time and joining us tonight here on In Focus. So, the Omicron virus, highly transmissible, new variant that has now appeared in 19 countries. Is this a matter of concern for you as far as the spread of this? We already know that it is a variant of concern.
Yes, so it's not surprising because we are living in a globally interconnected world, and of course, microorganisms, including infectious diseases, they can't move from one part of the world to the other. But it's concerning because of the high number of mutations of the new Omicron variant. The investigation is still ongoing on the issue of the transmissibility, whether it will evade the vaccine or even our immune system, whether it can cause severe disease, whether it will affect the other measures, countermeasures that we have like diagnostics, therapeutics. So that's the reason why we are calling on countries to prepare ahead of time. Of course, not by trying to ban flights from countries that were transparent in reporting, but enhancing their capacity to detect and respond to potential increase in number of cases.
Yeah. Looking at the countries where it has now been detected, are those countries geared up to respond to it as far as their health systems are concerned?
Well, the issue of health system preparedness is a continuous process. We have to continue to expand our capacities as the COVID situation evolves. As you can see, we saw where Delta variant overwhelmed a lot of health systems, including India and quite a number of countries in Africa. And as we continue to see new variants evolving and maybe potential high transmissible rates, it's important for countries to continue to expand their capacity, ability to dictate first of all, and then their capacity to isolate and treat these patients and continue to do the genomic surveillance.
Yeah. Though many of the surveilling countries and partners with WHO are continuing to share this information routinely on a daily basis, it is estimated that it will probably take close to 7 to even 14 days before we fully know the picture of how this variant is going to respond to the various vaccines that are currently available. But do we know so far any cases of severe illness, hospitalization, and even deaths that are linked to this variant?
Okay, information on this variant is still not adequate. We have to continue to sequence more and get more information. But the information that is available to us is that most of the cases seen are mild to moderate cases. But there is also a concern about reinfection of someone that was already previously infected by COVID. We still don't know how transmissible it's going to be. We still don't know whether it's going to evade immunity. So that research must continue, and we have to generate more information to understand the behavior of the new variants better.
Yeah. How important is vaccine penetration in our response to this particular variant?
Yeah, vaccination is very, very important, not just to COVID, but to most of the, to all, I would say all vaccine preventable diseases, because we know if you have an effective vaccine, it's a very good preventive measures. So particularly focusing on the COVID-19 vaccination in Africa, we are still way behind. Majority of countries around the world, especially the high-income countries, have reached, some of them 60-70% of their population. We are still at about 7 0.5%. So we have vaccinated fully about 102 million people. We have over 237 million that have received at least one dose. So you can see that we are still lagging very, very behind. And the importance of this is that we have a population that is very susceptible. So it means that if we have a new variant that is highly transmissible, it will move like wildfire in a population where vaccination coverage is very, very low.
And having made the appeal to your 194 member states to speed up really their distribution of vaccines to high-risk groups, what are your expectations?
Yeah, so especially for low and middle income countries, and we know majority of countries in Africa fall within this category, we need to see additional doses coming, and when they arrive in countries, that the countries will quickly roll them out so that we expand the vaccination coverage as much as we can. As you know, we have this new variant. The holiday season is coming in just a matter of weeks. We know that people don't usually comply with the preventive measures during this festive season, which is another risk of that provides a breeding ground for spread of viruses, including the new variant. So what we expect is that as soon as countries receive additional doses of vaccine, we need to ramp up our ability to vaccinate people and increase the coverage as much as we can.
Now, as the Omicron variant has been designated a variant of concern, I believe there are several actions that, as the WHO, you recommend countries should undertake should this be detected by their surveillance systems that are in place. What are those actions?
Yeah, so first of all, is for countries to expand even the capacity for genomic sequencing. And secondly, we need to expand the national surveillance capacity itself, the laboratory capacity, and prepare the health system to deal with potential increase in number of cases. We saw what happened with the Delta variant. Oxygen was very, very scarce on the continent. So we need to have the human resource capacity ready. We need to be ready to expand hospitals or even community treatment centers to deal with potential additional cases of these new variants.
The highlighted fact about this currently is that it overall presents a very high global risk. To many people, they might not understand exactly what that means. Just expand when as the WHO you say overall global risk as assessed by you is very high with the Omicron variant now already out there in various countries. What does that mean?
So when we say the risk is very, very high, it means that, yes, it can spread quickly to cover all countries like we have seen with the Delta variant. And when it turns out to be a virus that is highly transmissible, presents with severe disease, and evades immunity, for instance, it's going to be much more challenging than what we have responded to previously. So that is why countries need to be alert, and we need to make sure that we are preparing to respond for potential increase in number of cases. But additionally, the basic things that we know, they do still work. Preventive measures, wearing of face masks, keeping your distance away, avoiding unnecessary mass gathering, maintaining hand hygiene is still very effective because the virus or new variant moves with people, and if we reduce that interaction, we will automatically reduce the spread of the virus.
Yeah. For many countries in the Southern African region, South Africa in particular, having seen the response from other countries, they're asking the question, what is the WHO doing? Because it seems the current system disincentivizes countries from alerting others to the threat and being transparent. What are you doing to discourage this kind of behavior?
Yeah, first of all, we commend the government of South Africa and Botswana for their transparent and early reporting. So this is something that we sincerely appreciate as WHO, and a good number of countries do appreciate this. So in terms of incentivizing, really what we are calling for is global solidarity, so that countries will not hide variants when they discover them. Because if you react by imposing travel ban on a given country, it means that tomorrow the tendency for another country to report will reduce. So we have a call for global solidarity, and we continue to stand with the African countries in solidarity, and we do the same, calling on the global community to respond with solidarity. And as much as possible, we have published a guidance today, travel advice, to apply a risk-based approach based on science and the risks really that it poses, not just taking decision without conducting that risk assessment. So we will still continue to call for the global solidarity for countries that are transparent in their reporting.
Dr. Mary Stephen, I appreciate your time, and thank you very much for joining us tonight on In Focus. She's the Technical Director at the World Health Organization's Regional Office for Africa, Dr. Mary Stevens.